Today we are going to discuss about the surface marking of the lungs with its visceral layer and the parietal pleura. As you can see that there is a thoracic cage that is carrying a pair of lungs inside, and you can visualize that the apex of the lung is almost an inch, you would say, or 2.5 centimeter above the medial 1/3 of the clavicle. And at the lower margin, the lungs, they end up at higher level than that of the thoracic cage. In this very diagram, we can see that the margins of the lungs are marked with the pink color and being also covered by the tightly adherent visceral pleura, but the parietal pleura is being marked by the green color, and almost it descends 2 centimeter below that of the visceral pleura. In the lungs, we have to address two recesses, and let me tell you what recesses are. These are basically two folds of your parietal pleura, and they are supposed to receive the lungs for the expansion during deep inspiration. So it's a reserved space present where just see the location of the costodiaphragmatic recess on both sides, and in this picture you can visualize the costomediastinal recess over here. It means the costomediastinal recess is lying in between the costal margin and the mediastinal area, and the costodiaphragmatic is present at the lateral margins on both sides of the lungs. Through this diagram, you can see the counting of the ribs. Ribs are being shown in blue color, number 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. They are forming the lower 7, 8, 9, 10 are forming the costal margin as well. The sternum with its manubrium, body and xiphoid process are being marked in a green color, and yellow color is showing the costal cartilages here in this picture. This is the lateral view of the thoracic cage. I wanted you to show the margins here. This is sternum. If I can mark for you, this is, yeah, this is sternum, yes, and behind you can see the spinous processes, and you are looking from the lateral aspect. So this one is the anterior axillary line, this one is the posterior axillary line, and surely this is the mid axillary line. Now here we can see that this is the manubrium of your sternum, this is the body of the sternum, and this smaller piece is the xiphoid process of the sternum. And here is the clavicle. This one is the first rib, and you can count below and find out how many ribs are taking part in the articulation with that of the sternum anteriorly. This is the posterior aspect of your thoracic cage. Here the important landmarks are the 12th spinous process, and you can see the two floating ribs. This is 12th one and this is 11th one. The surface marking of the lungs, as you know, is important for us, and we can visualize that if there is the apex of the lungs that is present here, it lies with the covering of its cervical pleura and the suprapleural membrane or sepsin fascia. It is almost rising high up 1 inch above the medial 1/3 of the clavicle. Here in this picture you can see the clavicles. I want to show you on both sides. These are the clavicles, and the blue color lines are showing the mid clavicular lines. This is the landmark which is important, and the green lines on both sides are anterior axillary line for the apex of the lungs, which are covered with that of the cervical pleura and the suprapleural membrane. they are almost an inch above the middle, this medial 1/3 of the clavicle. If you find lungs inside, if they are placed, we have to now trace the anterior border of the right lung first. So concentrate on this sternoclavicular joint first. Here you can see this is the sternoclavicular joint, and I have marked a pink colored dot over here. This is the first point we have to take for the anterior border, and after that first point we have to reach to another point in the median plane at the sternal angle. The yellow line is showing the sternal angle. So second point is in purple color. From here we have to trace down and reach to the third point, which is just above the xiphisternal joint. This is the area which is for the xiphisternal joint. So point number 1 is, let me repeat, at the sternoclavicular joint, marked by the pink color on the right side, and second purple color mark is on the median plane at the sternal angle. Sternal angle is shown with the yellow line. Then the third point, vertically running downward, the line is touching to a point which is just above in the median plane, just above the xiphisternal joint. On the left side, if you can see that all points are similar, but if I join them, the left border, point 1 again at the sternoclavicular joint, second is again at the sternal angle, but the third point you get at the fourth costal cartilage. From here, what is going to happen, almost this line has now to pass 3.5 centimeter from the sternal margin, and it forms a curve, you can see here, and runs downwards and medially to reach the sixth costal cartilage. The point here is the sixth costal cartilage, and now we concentrate for the lung, the surface marking. First point was at the left sternoclavicular joint, then the purple line is descending downwards up to the yellow marking where the sternal angle is there for the second point. Third point is at the fourth costal cartilage, and from here in this region there is a cardiac notch, and now your anterior border has to descend up to the sixth costal cartilage. Then it has to do what? Wait. It crosses your sixth rib in the mid-clavicular line, which is marked with the blue lines. Then it crosses the eighth rib in the mid-axillary line. Mid-axillary lines are marked with the extreme pink colors on both sides of your rib cage. Now see, after running that lateral course, the inferior border has reached posteriorly, horizontally, where at the lateral aspect of the T12 thoracic vertebra, and the purple point is marked 2 cm lateral to it. Now it ascends upwards to reach the C7 cervical vertebral spine, and now this is how the posterior borders of even lung and the pleura coincide and are being formed in such a way. For the surface marking of pleura, again reconsider the points. Number 1 point on the left side you can see is at the sternoclavicular joint. Second point is at the sternal angle at yellow marking. Then it reaches to the fourth costal cartilage. Then again definitely it has to move towards the outer way or descends outwards along the sternal margin up to the sixth costal cartilage. Now what happens? The inferior border has to pass laterally from the lower limit of the anterior margin. Now it crosses, you can see, the eighth rib in the mid-clavicular line. That was the difference of 2 ribs in case of pleura in comparison to that of the lung. And it crosses now 10th rib in the mid-axillary line, which is again marked with the extreme pink lines on the lateral edges. Now it has to pass at the lateral border of the sacrospinalis muscle and further passes horizontally to reach the lower border of the 12th thoracic vertebrae, posteriorly 2 cm lateral to it. For this, we reconsider the diagram of the purchase aspect again. Again these are the points for the marking of the parietal pleura, that it's 2 cm lateral to the T12, ascends upward to the 2 cm lateral to the C7 spine.